Does your stomach feel full, tight, or swollen after a meal? Chances are you're probably bloated. Bloating causes the belly to look larger than usual, and it may also feel tender or even painful. It has a lot to do with what you eat and how quickly you eat. On today's program, we'll talk about why and when bloating happens. We want to help you better understand the care you need and deserve. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Bloating can get in the way of work or day-to-day activities, and it's common among both children as well as adults. To talk about this and more, let's welcome our guests. With us is Dr. Eric Yasay. He's a gastroenterologist and clinical associate professor at the UP-PGH. Also with us is Dr. Maricar Escultor-Can. She's an internal medicine specialist and clinical nutritionist from the Makati Medical Center. Now, gas is the most common cause of bloating. It builds up in the digestive tract when you inhale air or when undigested food breaks down. I'll start the discussion first with Dr. Eric. Dr. Eric, what are the causes of increased gasiness? Yung mga common causes nito?
Well, yung bloating nga can represent increased gas production in our body. In the vernacular, it is more commonly described as kabag, empacho, or hindi natunawan. So pinakamadalas, bloatedness or the sensation of feeling of fullness occurs after eating or drinking spree kapag napainom ng marami or nakakain ng madami yung mga pasyente natin. It is caused because of increased acid production and gas formation when our body starts to digest food. No? So yun yung mga most common. And then other than that, of course, we also think about decrease clearance of gas or kung mabagal yung paglabas ng gas sa ating digestive system or kung may blockage dun sa digestive system. These things can either increase your gas production or decrease your clearance of gas in your GI tract.
So is it mainly that? Ganun ba kasimple na pagpapalit mo lang ng bilis ng pagkain? Will this be able to alleviate bloating?
Most commonly, nalipasan niya ng gutom or walang time kumain. That's why ang bilis nating kumain. And sometimes, kapag bumabawi, yan yung tinatawag ko sometimes to my patients, actually is the reason why you produce more gas because you have to put out more acid and digest food, and then that will give you more gas than more than the speed of eating per se. And then, of course, kapag nagmamadali, you tend to eat in gulps, so mas madami yung nasaswallow na air. So that can also add to that.
But you may also be feeling more bloated than usual these days, and the latest culprit is, of course, stress. Ngayon, Dr. Maricar, paano ba nagkakos ng bloating ang stress? Halos lahat ng tao very stressful nowadays.
Okay, so usually when we are stressed, we tend to seek foods that are salty or sugary, no? Sometimes referred to as your comfort food. So it is another contributory factor to bloatedness, which is the character of the food. So if you will eat foods that are high in sugar and salt, but low in fiber, such as highly processed foods, because they can slow down the transit of the food in the GI tract. So also, when you eat these processed foods, you tend to drink carbonated sodas also, di ba, yung soft drinks, or some people, sparkling water. So these drinks are infused with carbon dioxide that can aggravate actually the bloatedness.
But I'd like to talk about cigarettes naman and how this affects not just your stomach or bloatedness, but the entire body. Because when smoke is inhaled, it also enters the stomach and it goes through the blood system. The elements of the cigarette goes all the way around the body, and it can cause bloating. Now, my question is, Dr. Maricar, how does cigarettes affect someone's bloatedness?
So perhaps I think it has something to do with the inhaled air that causes the bloatedness whenever a person smokes.
Now, I'd like to talk to Dr. Eric. What other factors do Filipinos commonly do that can contribute to bloating?
Well, madami tayong habits, no, as Filipinos. So we are very fond of buffets. No, well, probably the pandemic has decreased that episodes of buffets. But our eating styles and habits actually can add to the risk of developing bloating. So, madalas tayo nagpapalipas ng gutom when we're busy, and then we overcompensate by eating a lot after when we have time to eat. And then, yun nga, takot tayong magutom eh. Yan yung culture natin eh. So that's why we tend to eat more than we should, and that causes bloating.
Fiber is essential for a healthy diet, and it's best known for its ability to prevent or relieve constipation. But high fiber food can cause some to produce excessive amounts of gas, causing bloating. Dr. Maricar, what are some examples sa mga pagkain na mataas ang fiber?
Some clues to look for if you want to choose high fiber food items. So when you see the word whole grain, whole wheat, and bran whenever you choose your bread, your rice, or your cereal. So that means that you are choosing high fiber options. In terms of fresh fruits naman, I advise them to choose the fruits that are pulpy or those that are usually eaten with the skin, okay, such as your apples, or fruits with fibrous flesh, such as your pineapples and your mangoes. So for the vegetables naman, they are usually your leafy greens. And of course, you also have your nuts and seeds, which are also included in your high fiber list.
Now, how does light exercise naman after eating? How can this help reduce that feeling of bloatedness for some people? Now, a lot of people might think exercise, when they think of exercise, it's something really rigid. But a light walk, a short walk, is this a simple activity with a lot of benefits?
Yes, actually, when you do physical activities, such even kumbaga short walks around the block, it can stimulate movement of your bowels, which can facilitate the movement of the trapped air. So it can be helpful.
A lot of our viewers say that ginger naman is also said to reduce bloating. Is there any truth to this, Maricar? Marami bang benefits ang ginger in the form of maybe tea to help those who have frequent bloating episodes after eating?
Actually, I come across 2 studies relating ginger and bloatedness. So basically, the mechanism is that ginger aids in speeding the emptying of the stomach, as well as relieving patients who have functional dyspepsia. So that's the population of the patient that they investigated. But for these studies, what they used are ginger capsules. So the dose is at 1 to 1.5 gram in divided doses per day were used. So the authors of the study also included in the conclusion that ginger tea, so ginger in the form of tea, may also offer similar benefits, but they were not able to do a study using the tea.
Dr. Eric, meron ba kayong mga tips para sa mga viewers para mas ma-minimize ang kanilang feeling of bloatedness pagkatapos nilang kumain?
Apart from small frequent feedings, no, so wag kumain ng sobrang dami. Tama yung sinabi ni Dr. Maricar, no, to walk, no, because the pull of gravity can help bring down the food to the lower parts of the GI tract. Yung iba kong sinasabi to my patients would be to do a food diary. So what is a food diary? It's a list of food of your triggers. Very important yung food diary because the triggers are different from person to person, no? So, hindi naman pwedeng diktahan natin na ito yung one size fits all, na ito yung kakainin at hindi. What actually is more useful is a person to do his or her personal food diary of food triggers so that ito yung mga iiwasan ng food.
Now, bloating is not always from eating too much or too fast, as earlier mentioned, but sometimes there could be a health issue behind it. We'll talk about this and more when we come back. We're together in health.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Bloating is usually normal, but it can also be something serious. How will we know if it's just a nuisance or a cause for concern? I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines. where your care comes first. Dr. Eric, what are some of the medical conditions that may cause bloating?
The other conditions that can cause bloating would be mechanical conditions. Ibig sabihin, pag may bara sa digestive tract. No? So, this happens when you have inflammation of your GI tract or if you have tumors of your GI tract. Like, for example, if you have colon cancer, the gas gets trapped inside at hindi makababa yung gas doon and you will feel bloatedness. So another condition would be what we call paralysis of the GI tract. No, we call it ileus scientifically. No, pero a lot of patients who are bedridden, who suffer the stroke, who have severe infections or uncontrolled diabetes will have a slowdown of the movement of the GI tract. Kaya natatrap din yung air inside. No? So these are just some of the medical conditions that have explanations.
Now, a person with food intolerance has a difficulty digesting certain foods. And this is different from a food allergy, which results from an immune system reaction to a specific food. Dr. Maricar, how can a person tell if their bloating is caused by food intolerance?
So actually, there are tests that we can do. I refer my patients for them to have the food intolerance test, so which is actually a blood test wherein the patient's blood will be extracted and then it will be analyzed if they have an intolerance to certain food items. So usually there's a panel of food lists, and then food items are interpreted if they should be eliminated or they can be eaten in moderation by the patient or they can continue to consume these certain food items.
We've been talking about bloating for a while, but a lot of people, when they hear about bloating, they also may associate it, especially women, during the part of their menstrual cycle. Dr. Maricar, is this the same thing? How can a woman tell if it's bloating or weight gain?
Okay, so that's a very challenging question, but perhaps I think the best way to determine if the bloating is just caused by hormonal etiology is to observe if it is associated with other symptoms of your premenopausal symptoms such as mood changes, any discomfort that you feel in the hypogastric area.
Meron bang mga gamot na pwedeng regularly tinitake ng mga tao that may cause bloating?
Yes, so madami talaga. So very common dyan would be your pain relievers. No? So syempre, of course, a lot of them would be over the counter and our patients will not know na these medications actually decrease the protections that we have against acid. Examples of this would be aspirin, mefenamic acid, celecoxib, diclofenac, naproxen. Yan. Very, very common yan sa amin to see patients with that. And then the other medications that sometimes are over the counter and are abused would be the medications against diarrhea. Of course, di ba kapag may diarrhea ka, mabilis yung paghilab ng tiyan mo, you want to stop that. No? So that's why you take Buscopan or Imodium or loperamide. No? So this naman has the side effect of paralyzing your GI tract and then hence trapping air and causing bloatedness.
Okay, so temporary bloating shouldn't be a cause or worry, but anyone with bloating accompanied by other symptoms should see a doctor. When we come back, what else can you do about your bloating concerns? Stay with us. Your health is our mission.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
In most cases, the symptoms of bloating can be prevented by adopting a few healthy lifestyle changes. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. We're your connection to healthcare. Swallowing air can be one reason why you're bloating, and there are a number of things that you can also avoid. And one of those we've been talking about is carbonated drinks, for example. Dr. Maricar, we've been talking about carbonated drinks, bawal ito, high salt, high sugary foods. What else? What other common foods do Filipinos eat na nakakapag-contribute sa bloating?
Actually, isa sa hindi namin na-mention kanina, yung chewing of gum. Usually, it also causes bloatedness because when you chew gum, you also swallow air. Eating in a rush. So, yun, kumbaga contributory din, which I think it was already mentioned na rin kanina.
Okay, now when it comes to home remedies, Dr. Maricar, meron ba kayong masasuggest sa mga viewers for those who feel simple bloating for that matter? Is there something at home that they can do to relieve that sensation?
Okay, so aside from the dietary factors which we have already discussed, so some experts may also recommend to do certain exercises, di ba, even at home. Kasi even if we encourage the patient to walk, it's difficult with our current restrictions. Okay, so there are some experts who say that there are certain yoga poses that the person can do to facilitate the relaxation of the hips and lower back, to facilitate the release of the gas that build up in the colon. So there are also abdominal massages that can be done. So usually it is done in a circular clockwise motion, starting from the right anterior hip bone, going up across the rib cage, and then down to the left anterior hip bone and across the hypogastric area or the puson area. So you can do circular motions. But I would just like to remind that if you will do these exercises, at least give your stomach a time to empty. So that usually takes mga 2 to 3 hours. So if after that interval, you still feel uncomfortable and you still feel that there is trapped air in your tummy, so you can try to do these maneuvers at home.
Okay, very good advice. First time I heard of those exercises. I'm going to try that next time I feel bloated. Now, Dr. Eric, the whole point of trying to relieve the symptoms of bloating is try to let the gas out, try to release that gas. But are there medications that you prescribe your patients who have a more difficult time, those with bloating sensations that last for more than 2 to 3 hours?
We first try to analyze what causes the bloating. So if it's hyperacidity, we give antacids, no? So or and acid suppressants. So if there's a motility problem, ibig sabihin hindi gumagalaw talaga yung bituka, we can give prokinetics, no? So some of this would be our viewers will be more familiar with Placil, like metoclopramide and domperidone, no? Or motilium, no? So these are just some of the medications that can make your GI tract move. Others would be yung mga antispasm naman. This would be, of course, relying on a diagnosis. So it's very important na before you self-medicate, you try to analyze first kung ano talaga yung nararamdaman, especially if you have alarm symptoms na bumabara yung bituka.
Dr. Maricar, before we go, do you have any advice for our viewers with regards to the proper diet or what kind of diet para ma-minimize naman ang bloating?
We usually recommend talaga an individualized diet approach. Okay, so we emphasize that there is no one-size-fits-all diet. We can give you the general recommendations as we have mentioned earlier. But if you want a more tailor-fit or customized diet, so you can keep a food diary and then you can consult a registered nutritionist dietitian. You can show them the food diary so that they can prepare a good diet plan that is appropriate based on your condition.
And Dr. Eric, any parting words or advice for our viewers when it comes to minimizing bloatedness?
Well, ako, siguro probably aside from stopping smoking would be your food habits, no? So be aware that we want small frequent feedings, don't skip your meals, yan naman yung usual advice. And then of course, when you develop alarm symptoms, seek consult right away.
And we're glad you could have joined us here on Med Talk Health Talk. Thank you, gastroenterologist Dr. Eric Yasay and clinical nutritionist Dr. Maricar Escultocan. Bloating is rarely a symptom of something serious. For most people, the remedy is simple. Control portion sizes, eat less fats, and eat slow enough as well as stop smoking. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk on CNN Philippines. We're here to help build a healthier future for you.